Hi everyone, I just wanted to make this quick video to introduce myself, let you see who you're going to be meeting on Monday, and to do some quick housekeeping just so you guys can hear some expectations, get a little bit more clarification about how consolidation is going to run, and hopefully alleviate some stress for you guys as well. I apologize, these videos are always a little awkward, and I am reading off of some of my Word documents, so I stay on track and hit the key points I want to address in this video. The email that this came with will also have a few points that I want you to read, just so you know how to prepare for the first day. That being said, if you have any questions, please email me through D2L and I will respond. So my name is Jen Riley. On the floor, you're welcome to call me Jen. In all your communications online, please refer to me as Professor Riley. And I think this was the direction Liz or Professor Seabrook had also given. I'm a full-time faculty at Lambton College in the Practical Nursing program, but I have taught May consolidation and BSc clinicals for many years. I am an RN with a master's. My background is in medicine and palliative care, and I still hold a casual position on medicine so I can maintain my skills, my relationships with the hospital, the managers, the nurses, and that's really helped me create some great learning experiences for my students. Just to be completely transparent, I'm returning from maternity leave to teach you guys, but I feel so confident I'm going to give you an excellent clinical experience. I am taking the time this week to shadow on palliative for a morning, just to see what the new norm of teaching is, so I know what we can and cannot do, so those don't hinder our learning experiences. That being said, I've taught on palliative for over 4 years. I have an excellent rapport with the manager, the nurses, the unit helpers, and I really think that will help give you guys a great experience. Palliative care is near and dear to my heart. Again, being completely transparent, I lost a really close family member this past year in 2020, and got to see firsthand how the impact of good palliative care and interprofessional teamwork really helps to give a patient a good death and to make a really sad experience as meaningful as possible for the patient and for their family. So I'm hoping that through what I've learned through that too, I can impart that on you guys and make you guys better palliative nurses as well. I do have a young daughter, and I'm at the hospital very early in the morning, usually by 5:30, because I like to know your 8 patients through and through, so we don't miss anything. Sometimes the nurses step back when they know students have had it, and I want to make sure that I give you the safest educational experience and also provide safe care for these 8 patients we're looking after. So that being said, I go to bed early. So please keep in mind that if you send an email in the evening past 8 p.m. that I may not see it until the next morning and won't respond to you, promptly, obviously. So review your assignments ahead of time, and please use post-conference to ask for any assignments or next day questions. I like to go over assignments when I know the due date's coming up, but that doesn't mean that you shouldn't do the work to look over the rubrics, so you can ask those questions and get clarification earlier so you can produce the best product that you're going to submit. And it's also, if you ask these questions in post-conference, it's a great way for the whole group to get the same clarification. Just a quick discussion, points for post-conference. So most will be through Teams. I did send out invites today for all of you guys so that you already have them in your calendar. The one thing you'll note is there's a large space of time between when we finish clinical on the floor and when the post-conference starts. That was because I don't know how far you guys have to travel to get home, shower, maybe grab something to eat. So the first thing I'm going to ask, or one of the things I'm going to ask on the first day, is what is a reasonable time. If we're all, within the Sarnia-Lambton area, then maybe we can shorten that time. That way we'll get done the day sooner so you can get to your assignments, get to your CPs, those types of things. So if you think that when we end at 1:30 we could start post-conference earlier, that's what I would like to kind of come to an understanding as a group. Post-conference will always be 1 hour, regardless of what time we start it at. The other thing is, even if we don't have a Teams post-conference booked, I will still be having informal ones on those days that have the asterisks on that calendar I sent you guys. So we'll still be having discussions. So just be prepared for that. I like to discuss in post-conference. And when I say I like to discuss, it is not going to be a time for me to talk at you guys. It's going to be a time for you guys to process everything you've learned, to share your experiences, to ask questions for some critical thinking. And we're also going to go over some competencies. So each day, hopefully we can be getting some things for your CPs that we can fill out. I have an ethical piece that I'm going to be working with you guys on so that you can hit that point. But you guys should be leading this. And by leading it can give you give you guys some examples you can use in your own CPs about, how you're using critical thinking and leadership. I think that's all I wanted to say about that. Next, for assignments, I just wanted you guys to know that all the feedback you'll be getting on your assignments will come through Dropbox. I don't know what you've experienced before, but you'll always be getting a document back with my feedback through Dropbox. Very rarely, unless there's something that I really need to explain better in an email, will it ever come in an email. I will get your assignment, I bring it up in Word, and then I use track changes to put my comments in, and then I save it as a PDF and send that back so that you can see all the grammar or spelling things that I've changed. And I also leave comments in the side so that it gives explicit direction or feedback for what needs to be changed. And sometimes it's positive feedback too, so make sure you're reading all of them. If anyone is very track changes savvy and would prefer me not to send the PDF, but would prefer me to send Word document back with track changes, just let me know. I just know a lot of students find it too confusing and they don't make the right corrections. So that's why I send the PDF, because it's a lot more clear where my feedback is. I expect students to read all my feedback. If I can stress anything else to you guys, you need to read the feedback. This is also the document I use to compare your resubmission to see if you followed my directions. So I bring that up, bring your new submission in, and I go, page by page following it. So you need to follow it as well. I always am up for you looking for clarification if what I gave you for feedback doesn't make sense. So please make sure you let me know. Let me just see. I think that's everything that I wanted to say about assignments. I'm going to send a separate email about the learning plan. I know in the presentation that Liz posted, she gave you guys direction. I'm probably in the video going to repeat most of what Liz said and just give a little bit more feedback of where I see students go wrong or they forget to do something. The better your learning plans are, the easier it is for me to mark. So I'll give you some direction. Please, I'm making these extra videos to help you, so please follow them. And the more work you put up front means the less corrections, or the more likely you are to have satisfactory, which then saves you time of having to do a resubmission. Because if you don't do a good job the first time and don't put a big effort into it, ultimately it's going to hurt you because you're going to be getting into the busy time and you're going to have to spend all this time correcting. So please do the work at the forefront and listen to the instructions, and it will make your life a lot easier when it comes to the assignments. So Sunday, April 25th. So this is the Sunday before clinical. I'm going to go to the palliative floor to get patient assignments. I'll send you all an email Sunday afternoon so you will know your patient's health history. For the privacy's sake, I will probably just have your name and diagnosis and maybe some transfer information, how they walk. I won't put female or male. I won't put the room numbers because Sarnia is so small and you can track things. That will be information which shouldn't affect your research anyways, that I'll give you on Monday morning. I probably will have it all written on one sheet that I'll scan and send in one email so that everyone will get it and you just find where your patient information is. I always attempt to pick patients that should be on the floor the next day, but there always are unplanned transfers, discharges, and the floor that we work on, unfortunately, deaths. So that's what I'm up against. Please come prepared. I know this is a new learning experience for you guys, and I totally get that. If you're not doing the bare minimum of preparing, I can tell, and that's where a learning contract will go on, be started right away. So come prepared. You're not supposed to know everything perfectly, but if I can see that you at least know where to get and are working towards it, that's a huge step, and that will help you a lot. So the first day, we're going to meet outside the hospital entrance at 6:30. So I'll meet you guys down there. I will be masked. Because I don't know your faces very well, maybe I'll see if I can pick out the uniform I'm going to wear the night before and have that in the email so you know who to look for. At least look for these glasses. The one thing I'm going to be confirming is that you have done your Lambton College screening, so make sure you're showing me that. And you also have to have your COVID consent and waiver form submitted. I have an email that I will send out to you guys so that you get that exact document and know exactly what needs to be submitted and where. So once we're up on the floor, I'm going to ensure everyone knows who their patient and room number is. We're going to listen to report. Everyone should be listening to it. I'll clarify any expectations for the morning again, and I want to help support those who haven't been to palliative so that they feel comfortable. As many of you have been on palliative, I will expect you to go to your rooms and start your assessments. It's okay, you've been on it for 4. It's not really an orientation day because you've been here, so let's jump in. Each of you will have a patient assignment. My goal for clinical for the first 2 days is to evaluate everyone's assessments, including their vitals, so I can make sure you're all on the right track, that you're safe, and also just get your minimum charting up to par. So that's my goal, is I want to see everyone's assessments, give you feedback so that you know what to work on. And also if there's anyone who needs a little bit of help, I can start initiating some learning contracts, which are meant to help you so that you can grow the rest of the consolidation. But my hope is just to give everyone feedback and get you guys, going with your assessments and vitals. We're going to check to make sure you can all log on to Meditech and AcuDose. And then I just wanted to make sure you guys know all vitals and assessment findings should be reported to me and the nurse as soon as possible. If there's anything critical, please, you need to either find me or you're co-assigned right away. There's no excuse. So if there's something, significant findings, the patient isn't doing well, you need to find one of us and advocate for yourself and your patient. So that's the only other thing I wanted to stress because it's a busy first day. I know that's a lot to process. So please, if you have any questions that come up with all this, just send me an email. This was just to get you guys comfortable with me, give a few expectations, and we'll go over more on clinical. So I'm really excited to meet you guys. I'm excited to jump back in clinical. It's been a long time. I love nursing. Yeah, if there's anything I can say or do in an email to help alleviate some of your stress, please reach out.